Hello everybody, this is Chuck Wiger, State Senator, and today we're going to talk about PrairieCare. It's a treatment facility for mental health services. It's located in Maplewood, and very happy to have with me Dr. Asfia Qaadir, and welcome.
Thank you so much, Senator Wiger.
And the facility opened in the past few years, and it provides mental health services. Tell us about the PrairieCare and the needed services it provides for young people as well as their families.
Yeah, absolutely, and thank you so much for the opportunity. There's a large and growing need, as you know, in the community, including in Maplewood, and the services we provide are for young people from grade school all the way through high school, and we offer multiple avenues of services depending on the need of that individual and their family.
So, and the focus is mental health services.
Yes, the focus is on mental health services, so we provide diagnostic evaluations, we provide treatment, we provide multiple programming in which young people can receive treatment, and then we also do a lot of collaboration with parents as well as caregivers, doctors in the community, therapists. They may be working with social workers. We also do a lot of collaboration with the local schools as well, because we know that kids need to have opportunities for success in the learning environment, and that dovetails with what we want to do in terms of helping mental health and child development.
Okay. And you're located right near the intersection at White Bear Avenue and Beam in northern Maplewood, providing services to a number of people in that greater area, and you're a part of a overall PrairieCare system. Could you tell us overall about the program for PrairieCare?
Absolutely. So what we know about treatment, specifically when it comes to mental health and youth services, it's important to have a continuum. So what that means is, in addition to having hospitals in terms of managing crisis and safety and the higher risk need when there's a suicidal crisis or when there's a mental health emergency, we also know that kids continue to need services in the community when they transition out of the hospital. So we offer not only outpatient clinic services, for example, like you would see your doctor or therapist, go to their office and have checkups, but we also have a number of programs that we consider intensive outpatient programs. Okay. And what that means is availability of services for mental health treatment for young people, where they would go to a program Monday through Friday, yes, and they would receive high-level mental health services through doctors, nurses, therapists, social workers, and the idea is that that prevents relapsing when it comes to illness that would lead back to the hospital.
Now, Dr. Qaadir, we spent a lot of time at the Capitol, and as well as policymakers across the country, about the growing needs in the mental health area, and what more can we do in terms of prevention, providing services. Tell us more about some of the major challenges in the Maplewood area.
Certainly. Some of the challenges are not only unique to Maplewood, but they're statewide and nationwide, if you think about it.
Yes.
Mental illness is still, unfortunately, a cultural taboo, whether it's seeking out services or whether it's even talking about it in the community. And what we know is that the more people talk about something, the less of a stigma it becomes, because it becomes more relatable. What we do know is that suicide is the #1 leading cause of illness and death in young people when you look at age ranges from elementary school all the way through 50, 30 years old, 40 years old, midlife. And so it's something that a lot of people will have some type of exposure to, whether it's in a family or a loved one or somebody in the community. So the more we talk about it, the less stigmatizing it becomes. And I think that's the first step to prevention.
So get it out in the open, talk about it. It affects every family, if not directly, indirectly.
Absolutely.
And you mentioned the partnership with our schools.
Yeah.
Tell us more about that, because
yeah,
we want people to be able to continue with their education, the young people and the families. And so having the discussions, the support groups with schools, and how's that working out?
Absolutely. The collaboration we do with schools is integral to the success that the kids are going to have. So we do our job from a clinical standpoint to stabilize, do treatment, and identify what the needs are for this particular individual to succeed. And that communication that we do from PrairieCare to schools, whether it's with the principals, vice principals, teachers, school counselors, psychologists, social workers, we really want to build those relationships because we know that collaborating in the community for these kids is what's really going to help them stay in school, stay healthy. We get a lot of referrals from teachers identifying a struggling young person in their classroom and identifying that there may be an underlying mental health need that needs to be addressed.
Yes.
So we get a lot of referrals, particularly in Maplewood, from the school systems. That opens a dialogue with us so that when we then work with the young people, we can identify if there's a learning disability, we can identify if there's a mental illness that needs to be treated, and then we go ahead and we do that and we offer services.
So you do the diagnosis, come up with the treatment plan, work with the guardian, the parents, others
Absolutely.
that have a impact. How young might some of the participants be?
6 years old, 7 years old, depending on the circumstances that young person is experiencing. It may be that they're genetically loaded for a mental illness, maybe a family history of mental illness for many generations. It may be adversity that the child has already experienced. When they go into the learning environment, a lot of times that's where it becomes evident what their struggles are. And so when school staff can identify a struggling young person and communicate with us, we're able to then communicate back to the schools. So as young as 6, 7 years old.
Okay. And for services, is there going to be health care or insurance coverage that might be available to cover the expense?
Certainly. It's case by case in terms of what type of insurance each patient would have and what that insurance would cover. But what we do from PrairieCare standpoint, we advocate very strongly in support of the need of that young person to receive treatment and evaluations and have that opportunity. We know when we intervene early, those young people have a much better success rate in terms of being able to transition back into the community and be successful. So we work with the families, and regardless of what the insurance circumstance may be, to get them care.
Good. And in terms of the outreach, just doing educational programs, tell us more about that. There may be viewers that would like to learn more about.
Absolutely.
They may know someone that needs the service, but just things that we can do to be more aware of the importance. And you mentioned earlier too, just talking about it, getting it out in the open to erase the stigma that we all do better when we can help each other.
Yeah, I think that's the important point. Connectedness, so within the community, the more the various sectors, education, healthcare, policy, the more we are connected and having a conversation, the better it is for the young people. And out in the community, if you have a family member or a loved one that is struggling with mental illness, you know, and I think about this in the continuum developmentally, so not just young people, but adults. So if there are adults who are willing to seek out care, willing to talk about their own struggles in overcoming adversity, I think that sets an excellent example for the young people then to then reach out and say, hey, you know, I think I'm struggling, I need some help. So part of it is setting an example, but continuing that conversation.
Good. Any policy changes that, based on feedback that you've been getting from teachers or from young people and parents that might be considered for our school districts to make them more supportive?
Yeah, no, thank you. I think what we do from a clinical standpoint is we identify what the needs are for a young person, maybe in elementary school or high school, and then we communicate that to schools. Now, oftentimes, what's very helpful in that conversation is being able to figure out, okay, what services are available at a particular school. And that's not the same across school districts. It's not necessarily the same between schools.
Yes.
What the staff can provide, what they're supported, are the schools supported in order to provide the services they know that child needs.
Yes.
And so I think policy needs to support access to mental health for all.
Yes.
and particularly younger individuals so they can get care sooner. But policy should also address the needs at the level of the schools. So if staff are identifying the need through 504s or IEPs or opportunities for testing or opportunities
These are evaluation instruments.
Evaluations to continue to evaluate how that child is doing. Are they developing academically, socially? But I think also staffing. Do schools have the qualified personnel and staff to offer that? For example, paraprofessionals are incredibly valuable in the classroom. Sometimes they are partnering with the kids one-on-one. Sometimes the kids are spending a lot of their time in the mainstream classroom, but they do need occupational therapy services at school. They do need to have small social communication practice for social skills groups at some point during the school day. So the more schools are supported, I think, then that's where policy should really be.
Good. So I appreciate that message to those of us that are policymakers at the state, the local, the federal level. It's been labeled a crisis, the mental health needs,
Absolutely.
and it's something we'll continue to work on in a bipartisan manner. You're a psychiatrist, and dedicating your career, your profession to helping people cope and providing hope. Tell us why you entered that field.
I mean, I think it's compelling. I think it's so rewarding. It's so challenging. People identify, but it's such a rewarding experience when you are able to work with the child. And in my case, because I work with young people, their families, their parents, siblings, sometimes you get to know the family system.
Yes.
So what I always tell the kids and the families on the admission day when they first meet the team is, we're going to get to know you. We know why you're here, what the struggle is.
Yes.
We want to get to know you as a person. We want to know your personality. We want to figure out your strengths. Bring some hope back into, the picture, because for a lot of young people and their parents, it's hard to struggle. I mean, and a lot of folks don't understand why they're not doing well.
Yeah.
And so I think it's difficult for parents to have a sick child. Everybody can relate to that. But what I love about what I get to do every day is work with young people who, they have struggles. Yeah, they're struggling, and that's why they come to us. But every child has their own personality. Whether it's they love singing, dancing, whether they have a favorite song, whether they write poetry, whether they play an instrument, whether they just love to connect with folks, tell you a joke to make you smile. You figure out what gets these kids just radiant. And it's lovely to get to see them as they recover and they find hope, that they learn skills to communicate, they learn how to get their needs met. You can really see the family system just blossom. And I think, I don't know another line of work that lets you see that.
Well, that's beautiful, your motivation, your desire to help, and I wish you continued success. There's brochures too, and if someone would like to contact PrairieCare, I think we can put that on the screen, but anything you'd like to share about the various material here about PrairieCare?
This brochure has a list of our, again, if this goes on the screen, you'll get to see the variety of locations we have. One of the goals that PrairieCare has is to bring access to mental health services into the community. A lot of folks are familiar with having to drive long distances to access specialty services, and one of the important things we try to do is increase access to mental health care.
Yes.
So that's why we have a variety of locations, West Metro, East Metro, right in the city, right in the community. Paragon is one of our more recent services, which is what we call residential level of care. And again, if you go to our website, you'll be able to see a little more information.
And the website is?
If you go to prairie-care.com, you'll be able to see all of our services, and also we have our providers identified there too. So if you ever have a question, you have someone to reach. Just pick up the phone, give us a call. We're always happy to talk with families. If you have a question about how to access services or what we can offer for your family or loved one, just ask us.
And that could be anyone, or whether it's in your family, maybe it's you or a friend. Do this. This could be a life-changing call. And
one of the things I always try to stress, and I think PrairieCare does a wonderful job of this, is what we call needs assessment consultation.
Yes.
So if you give us a call, you can schedule it. It's of no cost to you, and basically you walk into our clinic, you get a chance to have a thorough evaluation of what level of services may be a best fit for your need. And we're able to give you a clear recommendation about that. It may be one of our services, it may not be. But because we're familiar with a number of services in the community, we can also point you in the right direction.
Dr. Qaadir, thank you so much for your service, for the great contributions being made by PrairieCare in our area and throughout the region. We wish you continued success.
Thank you so much, Senator Wiger.
Thanks. Please check that out.